2 active COVID-19 cases. That was the case count for the Thunder Bay District yesterday. Those low numbers come with students back in the classroom, continued economic reopening, and the resumption of many activities disrupted by the pandemic. For more, we're joined by Dr. Janet DeMille. She's the Medical Officer of Health for the Thunder Bay District. Dr. DeMille, good morning.
Good morning, Matt.
So case numbers briefly went up for a period in mid-September, but they've since come back down with only 2 currently active cases and just 1 announced in the last 7 days. How do you feel about our current situation, and do you find that encouraging?
I feel very good about our current situation, and yes, it is very encouraging. I think that the fact that we're sort of entering the fall and winter season where we are expecting in general that this virus will circulate more, that we're really entering that time period in one of the best possible situations in terms of both our low case numbers but also our higher vaccination rate.
So school has been back in session for about a month now, and in our area, we've only seen a really small number of cases associated with schools. Why do you think that is?
Well, the number one way of keeping schools safe is keeping the rates low in the community. So I think that this just links back to your first question. If when we can keep the rate really low, that schools are protected because of that. Because most cases in schools are introduced initially from the community. So I think that's the number one reason. However, schools have also implemented a lot of measures and, screening and all the measures within the masking, for example, and a lot of measures in the school setting to keep transmission, to really reduce transmission from happening in the school setting. And the other thing, of course, for youth that are, schools where there are youth 12 to 17, we have, that's a group that's also able to be immunized, and we do know that many of them are and fully immunized. And fully immunized individuals, regardless of their age, are much less likely to get COVID or get symptomatic COVID if they are exposed.
Earlier this week, the province announced that rapid testing would be available to some high-risk schools and childcare settings. Do you expect those to be made available at any point in the near future for Thunder Bay?
So I think that was an important announcement to make this available for schools and for youth in schools. And I think that this is just one more tool we have in our toolbox to help manage, cases or contacts or situations involving schools. And we're now sort of considering how and when we might use it. I'm not necessarily expecting that we'll have, the need for it right now or in the near future. And I do expect that if we did need, though, we would be able to get that fairly quickly. Really, this is a situation. There's sort of ups and downs, I guess, or pros and cons about using that rapid testing in a school setting. And I think we're just kind of considering when we might want to use that and making sure we have that available.
I want to shift now and talk about the vaccination requirements and the latest there. Last week, the Northern Ontario Health Units announced together that COVID-19 vaccination would be made a requirement for all coaches, spectators, and volunteers involved in indoor sport activities. Why is that being put into effect, and how important was it to have a similar policy across all of Northern Ontario rather than that being done by individual health units alone?
So we put that in effect because we felt that was a bit of a gap or in the current regulations under the Reopening Ontario Act because, it allowed basically that those individuals wouldn't necessarily have to be fully immunized. In contrast to some of the other people that have to go into a sports facility where organized sports is played, where they do have to show that they're fully immunized. And we did feel that was a gap, and I think that was sort of consistent across the province. And so we worked together across the Northern Health Units to sort of address that and basically put in a requirement for those facilities to also look at those individuals, the adults primarily, that are are part of that organized sports, whether it's coaches or volunteers or timekeepers and such. And it was really about increasing the safety of those sporting events And we wanted to do it across the North because we all recognized the same thing and felt that level of consistency was important, especially because we do have sporting organizations that cross our different jurisdictions. And I would say, and I acknowledge, I think this is one of the areas that we maybe had challenges with the pandemic, because I know a number of my colleagues across the province are also issuing similar letters of instructions, but they're also different in certain ways. And I do think that kind of creates sort of an overall confusion or the potential for confusion. So I think working across the North, we're well connected. We communicate on a lot of other things, and it felt the need to be able to be consistent on this one.
But not included in that requirement are the actual participants. Why not?
So the actual participants are not included right now in the current letter of instruction. I think people need to realize that, we really wanted to make, an evidence-based sort of direction on this, and we do continue to watch the situation and what's happening across the North with respect to sports, looking at cases and any spread and outbreaks that may occur, for example, and even following what's happening across the province. With our numbers fairly low, the risk is lower right now, but I am expecting that to change, and I think, I am encouraging, as are all my colleagues, youth between 12 and 17 to get fully immunized, and especially those that are participating in these organized sports or even school-based sports, that they be immunized, because that's the best way to kind of protect, keep those events, keep those games and practices safe, and also prevent sort of bringing it back to school settings. And I've heard recently in some of the larger health units where they are seeing more cases of COVID, that they have had outbreaks associated with sporting events. So, and that then, because it impacts youth, it could actually impact a number of different schools depending on the spread and vaccine status, for example. So I really encourage youth to be immunized, including those who are participating in sports. And at some point in the future, it might actually be a requirement, and I wouldn't be surprised if that happens.
So, and after those letters of instruction were issued, Hockey Northwestern Ontario announced their own policy and took that extra step and announced that it'd be requiring players over the age of 12 to be vaccinated. Do you think other organizations should take a similar step and be proactive?
So I definitely recommend that other organizations seriously look at making that a requirement. Again, I do think that this might become a requirement, whether provincially or maybe something that we do across the North. I see some other health units have included the youth participants in those organized sports. And I do think that this is the way things are going in general. And so I definitely encourage other organizations and recommend that they really look at this, especially when you're looking across many jurisdictions and bringing people together, potentially to play games or, for example, from different jurisdictions. And as we navigate the upcoming winter season where we might see more COVID in any jurisdiction, including those across the North, that those, there is a risk. And of course, to keep those things open, to keep those things going, that vaccine can be very important.
And of course, Dr. DeMille, we're coming up on the Thanksgiving long weekend, and later today, the province is expected to provide recommendations for people who happen to be gathering this weekend. What do you think we should expect to hear?
So I think it's an important for people to listen, and I think we're going to be paying attention ourselves and also putting out stuff on our social media. But I think we need to realize anytime we gather together in person that there is the potential for the spread of the virus, and we've certainly seen that in other types of events. And, when people come together, that could happen. So, I think some of the basic measures, if you have any symptoms of COVID-19, please don't attend a gathering. Please just stay at home and arrange to get tested. But if you have COVID, you don't want to go and spread it. For people who are, fully immunized, that's, less likely. There's safer events if people are fully immunized. As well, it's safer to be outside, and Thanksgiving is often a time, especially if the weather is nice, where we can be outside and maybe interact with others more safely outside, just because the virus doesn't sort of transmit so much, and often, it's the nice fall colors as well. So those are some of the things to consider, but pay attention, follow our social media. We'll be having more information on that later today.
I know when you last spoke with Amy Hadley, you said that one particular concern for you was travel, and even within Canada and to parts of the country where they are seeing high COVID case numbers, like out west in Alberta. Are you concerned that travel this long weekend, we could end up seeing an increase in positive cases over the next week or two from that?
So I remain concerned travel, whether it's due to the holiday weekend or at other times, people potentially bringing the virus in. We don't have a lot of COVID in our area right now, but certainly it can be introduced by somebody bringing it in here, and some of our recent cases have been associated with travel. So anytime people are traveling, whether they're going somewhere and then coming back, or if they're having visitors, or if they're people coming into work, we have to, you have to recognize that there's a potential that they could be bringing in or bringing back COVID, and really taking those measures to prevent that from spreading if they happen to, be in an unfortunate situation. And that is really, monitoring for symptoms, avoiding contact with others or minimizing contact with others, especially if somebody has symptoms. They should, isolate and get tested, but be aware of, the potential to transmit at any gathering. Wear a mask for sure, because that can reduce the likelihood of transmission. And certainly, as usual, we are encouraging everybody to be fully immunized, because these vaccines, work. They're not perfect in terms of preventing an infection, but they do substantially reduce the likelihood of somebody having an infection.
Dr. DeMille, thank you, as always, for joining us and bringing us the latest.
Thank you very much.
Dr. Janet DeMille is the Medical Officer of Health